An abnormal decrease in the size of a muscle is atrophy. The cell from which a muscle develops is myoblast. The abbreviation for Alzheimer's disease, AD. An otoscope is used to inspect the exterior ear canal. The procedure that is used to puncture the chest to remove fluid is called thoracentesis. Which of the following lab tests would be abnormal for a patient with anemia? Hematocrit hemoglobin. Hyperparathyroidism may be treated by which medical specialist? Endocrinologist. An abnormal increase in total of WBCs is leukocytosis. Extremely rapid breathing is called hypopnea. Which of the following suffixes refers to pain? Algia. A suffix used to denote a surgical repair is plasty. A mammogram is a radiograph of the breast. The term alopecia is synonymous with baldness. Another term for chewing is mastication. A nevus in th antecubital area is a mole on the inside of the elbow. An inflammation of a joint is arthritis. Fat makes up adipose tissue. The cause of disease is referred to as pathology. The function of the olfactory nerve is smelling. An oophorectomy is a surgical procedure of the ovaries. The study of diseases and treatment of the male and female urinary bladder is urology. A diagnostic procedure that allows for visualization of the urinary bladder is cystoscopy. A patient with hives most likely will report that he or she has urticaria. The membrane that surrounds the heart is the pericardium. A mucous membrane lines body cavities that open to the outside. The ventral region of the body is described as anterior. The body cavity that contains the intestines is the abdominal. Movement of a body part toward the midline of the body is adduction. The plane that divides the body into front and back halves is frontal. Reye syndrome can follow viral illness in children. The vertebrae of the lower back are the lumbar. An acute infectious skin disease caused by strep or staph is impetigo. The bone located in the posterior of the skull is the occipital. The type of bone fracture in which the bone is bent and partially broken is a Greenstick fracture. The peripheral nervous system is composed of how many pairs of spinal nerves? 31. The pons and medulla make up the brainstem. A failure of bone marrow to produce red blood cells results in which type of anemia? Aplastic. Protrusion of a part of the stomach through the esophageal opening in the diaphragm is a hiatal hernia. The tympanic membrane is the eardrum. The largest SRTRY in the body is the aorta. The SA node is the pacemaker of the heart. An X-ray taken to confirm a fracture of the distal forearm includes the radius and ulna. Which of the following demonstrates an involuntary muscle action? Heartbeat, breathing, peristalsis, pupil dilation. Which of the following organs are located in the rump? Liver. The diaphragm is stimulated by which nerve? Phrenic. An abnormal lateral curvature of the spine is known as scoliosis. The alpha cells in the pancreas are responsible for the production of glucagon. The surgical removal of the gallbladder is a cholecystectomy. The cranial nerve involved in blindness is a optic. The number of permanent teeth is 32. Legally, a physician may refuse to accept a patient if he or she chooses. An itinerary is a detailed outline of a trip. Professionalism may best be displayed by staying calm when dealing with angry patients. The ability to imagine taking the place of the patient and accepting the patient's behavior is empathy. The patient's medical record belongs to the physician. A breast mass is found in a woman whose mother and sister have died from breast cancer. She cancels her next 3 follow-up appointments. Which defense mechanism is she using? Denial. Personality differences are due to age, experience, heredity, environment. Which is not a characteristic desirable in a medical assistant? Impatience. Which is not an example of stereotyping? Young children react differently to stressful situations. To release medical information, the patient must sign a release form. Which of the following should be reported to the health department? HIV. Which of the following is objective data? Vital signs. Which of the following phone calls should be given immediately to the physician? Another physician. In Maslow's hierarchy of needs, the need to be loved and free from loneliness is a social need. If a patient refuses to consent to treatment, the medical assistant should delay treatment and consult the physician. An enforceable contract contains all of the above. The opposite of anterior is posterior. Informed consent should include which of the following elements? All of the above. All of the following are reasons for revoking a physician's license except providing atypical care. The control center of a cell of nucleus. Subcutaneous tissue is found under the skin, contains fat, is an injection site, connects the dermis to the muscle surface. Which is not a bone of the lower extremity? Humerus. The muscle in the upper extremity that is used as an injection site is the deltoid. The pacemaker of the heart is the SE node. Gas exchange in the lungs takes place in the alveoli. The liver makes bile, detoxifies harmful substances, produces heparin, stores glycogen. The fertilized ova implant into the endometrium. Testosterone is produced in the testes. The largest portion of the brain is the cerebrum. There are blank pairs of spinal nerves. 31. Gustatory receptors are located in the mouth. Insulin decreases blood sugar level. A decrease in the total number of white blood cells. Leukopenia. The physician is legally obligated to report deaths, births, communicable diseases, abuse. The prefix Brady means slow. The opposite of superficial is deep. An authorization in advance to withdraw artificial life support is an Advance Directive. Unconsciously avoiding the reality of an unpleasant event is denial. Tell me more about it is an example of an open-ended statement. The study of the cause of diseases. Etiology. Non-verbal communication may be conveyed by all of the above. Bulimia is an eating disorder. A cerebrovascular accident can also be called a stroke. Rubella is measles. A sexually transmitted disease caused by a protozoal infestation is trichomoniasis. An electrolyte that has an important influence of the activity of the heart muscles is Potassium. Which of the following respiratory disorders is characterized by loss of lung capacity? Emphysema. The type of membrane that lines cavities of the body that open to the outside is mucus. Another name for an open fracture is compound fracture. Which of the following types of scheduling is not a good type of time management? Double booking. What piece of mail should be placed on top when sorting the physician's mail? Envelope marked personal. Open punctuation is characterized by absence of punctuation after the salutation and the comma after the complimentary close. The federal insurance program that provides for the medically indigent is Medicaid. The process of transferring an amount from the day sheet to the ledger is posting. A numeric filing system requires the use of an alphabetical cross-reference. The file folder label for Jenny Holmes Mathis should be Holmes Mathis Jenny. Third-party participation in an office indicates the relationship between the physician, patient, and insurance company. A claim may be rejected by an insurance company because of the omission of all of the above. How much postage is required for a first-class letter that weighs 3 ounces if the first ounce costs 0.34 c and each additional ounce is 0.83 cents? When the word confidential is to be typed on the envelope, it should be placed below the return address. The most formal of complimentary closings is very truly yours. When making an appointment, which of the following is not needed? Insurance information. This type of call allows more than one person in more than one place to talk simultaneously. Conference call. This procedure protects against the loss of data. Backing up. A tickler file is future events arranged in chronological order. All of the following would require a CPT code except diarrhea. Which of the following characteristics of a receptionist could make an impression on a patient? Appearance, professionalism, manners, attitude. A direction to consider additional codes is see also. A V code refers to factors that influence health status. Mail that is open accidentally should be resealed with tape and notes as opened in error. Which of the following are EM descriptors? All of the above. Which is an example of a third-party payer? Medicare. In the Palmer system, the initial database includes a numbered list of present problems. A trial balance is a comparison of ledger card totals and account receivable balance. When adding information to the medical record, new notes are added. Newest to the front. Which of the following calls require immediate transfer to the physician? Another physician. Appointments should be scheduled in consecutive order without large gaps. Which is not part of basic information obtained at the patient's first visit? Diagnosis. Standard size paper and envelope for business correspondence is 8 1/2 x 11 number 10 envelope. Patient's ledger cards should be kept in a separate ledger file. The bank statement is reconciled with the checkbook. The record of the proceedings of a meeting is the minutes. Which of the following protects data from loss? Backing up. The scheduling system based on scheduling similar appointments or procedures together is called grouping. Appropriate information to include in a patient information brochure would be information about the scope of the practice. A new employee must complete which of the following? W-4 form. Which of the following abbreviations is not correct? HGB. Patient information that is released without patient's authorization could result in legal charge of invasion of privacy. A correctly addressed envelope includes omission of all punctuation. Which of the following circumstances would waive the need for a written release of medical records? A subpoena. In double entry bookkeeping, the original entry is put onto the daily log. The correct way to indicate an enclosure notation is enclosure. A superbill provides which of the following? Insurance claim. Which of the following is the purpose of records management? All of the above. Which coding system is not associated with medical procedures? ICD-9-CM. Which is not an indexing rule? Initials come after complete names. ICD-9 centimeter codes that refer to factors that may influence the patient's health status are V codes. The smallest piece of information that the computer can process is a bit. The index of files on a disk is the directory. The appointment system of the office should take into account the needs of the physicians and patients. Dear Mrs. May is an example of mixed punctuation. A master list of equipment inventory includes all of the following except the operating manuals. Which of the following hospital records may be released by the authorization of the attending surgeon only? Operative Notes. An illness that existed before an insurance policy is written is known as a pre-existing condition. A patient has not been seen in the office for 2 years. HI's record would be found in the Inactive Files. An important consideration when deciding how to position the computer monitor at the reception desk is patient confidentiality. Which group of patients should be escorted to the exam room and given instructions on what they are to do? All of the above. Which information is not essential for the surgery scheduler when requesting a surgery date? Name of assisting physician. The notation Juliet Jones Maryland means a copy of the letter is sent to Dr. Jones. A history and physical usually contains all of the following except results of lab tests. Under a managed care plan, the physician agrees to accept predetermined fees. Which type of insurance organization uses a fee-for-services concept? PPO. Which factor is not included when determining the level of service for E&M codes? Cost of services. When money is placed in an account, which of the following documents is prepared? Deposit slip. The most common color coding system color codes the patient's surname. Who is the legal owner of the information in a patient's medical record? The patient. Standard precautions are designed to be used for all patients. Disposable single-use gloves should be worn when handling specimens and when performing venipuncture. Normal oral temperature in degrees is 98.6 F. Normal respiratory rate for an adult is 14 to 20 breaths per minute. Vital signs include blood pressure. The pulse rate is usually higher in children than adults. Pulse rate is decreased by all of the above. A high fever occurs when the body temperature in degrees is 103 to 105 F. The pulse pressure is the difference between the systolic and diastolic blood pressure. A patient who weighs 45 kilograms also weighs how many pounds? 99. A patient who is 72 inches tall is 6 feet. During a physical exam, percussion is most commonly used to examine the chest and back. A patient's reaction to stress, use of defense mechanisms, and resources for support would be recorded under social history. Subjective findings include how the patient feels, information about the patient's family, previous pregnancies. Visual acuity is clearness of vision. The purpose of a proctoscopy is to examine the rectum. A patient in the Sims position is lying on the left side and chest with right leg flexed. A patient lying flat on the abdomen is in the prone position. The physician uses which of the following to examine the patient's eyes? Ophthalmoscope. The patient should be placed in which of the following positions for examination of the head and neck? Sitting. For an obstetrics exam, urine is routinely checked for the presence of glucose and protein. A patient should be taught that the best time to perform a self-breast exam is about 1 week after her period. An infection that has a rapid onset, severe symptoms, and subsides in a short period of time is called acute. Sterile wrapped items can be safely stored and considered sterile for up to 21 to 28 days. When removing a pack from the autoclave, you notice that the sterilization indicator has not changed color. You should unwrap the pack, rewrap the pack, replace the indicator, rest reels. Scrubbing an item with soap and water before sterilization is sanitization. The type of immunity that develops from having the disease is acquired active. When opening a sterile pack, the top flap should be opened away from the body. The finest suture material of the following list is 8-0. A type of instrument that is used to grasp or hold tissues or objects is a forceps. Betadine should not be used on the skin of a patient who is allergic to iodine. Wound drainage that contains pus is charted as purulent. The angle for the insertion of the needle for an ID injection is 10 to 15 degrees. A medication that is placed under the tongue is being administered by which technique? Sublingual. To administer an intramuscular injection, which needle would you use? 1/2 21 gauge. A type of drug that increases urinary output is diuretic. The physician orders 250 mg amoxicillin IM. The vial reads 500 mg per 1 milliliter. How much would be given to the patient? 0.5 milliliters. When a specimen is placed in a centrifuge, a tube of similar size containing liquid of similar weight should be placed directly opposite the specimen. Microscopic examination PF. A urine sample should be performed within 1/2 hour of collection. The absence of urine formation is termed anuria. Normal specific gravity is generally between 1.010-1.025. A CBC includes all of the above. Capillary blood is usually obtained from a skin puncture. A cholecystogram is used to view the gallbladder. Heat application dilates blood vessels. The wave on an EKG that represents contraction of the atria is P. The pacemaker of the heart is the Sinoatrial Node. A standard EKG has how many leads? 12. The standard speed for recording an EKG is 25 mm per second. To cauterize a small lesion on the oral mucosa, the physician may use an applicator with silver nitrate. A common lab test that may be ordered for a patient on committing therapy is ProTime. Which one of the following types of suture material is absorbable? Catgut. The minimum number of cells to be counted in a differential blood smear is 100. A hemoglobin of 10 grams per deciliter is approximately equivalent to a hematocrit of 30%. Which of the following lab results should be called to the attention of the physician? SID rate 30 mm per hour. The stain used to identify